Hello, my name is Dr. Joan Reed. I am Dean for Diversity and Community Partnership at Harvard Medical School, and I want to welcome you to this informational webinar on the Joseph L. Henry Oral Health Fellowship and Minority Health Policy. Next slide. A little housekeeping before we begin today's session. This webinar will be recorded and it's available on our fellowship website. It will be available on our fellowship website. Live closed captioning is available. All lines are muted. However, you can submit your questions to the webinar using the Q&A box that you will find on your screen. Next slide. Just sort of an overview for today's program. They will begin with my describing the fellowship in the background, and then you'll learn more about the fellowship experience through both the video and two of our alumni fellows, followed by a Q&A. Next slide, please. The speakers for today are myself. As I said, I'm Dean for Diversity and Community Partnership at Harvard Medical School and Professor of Medicine. But importantly for this webinar, I'm the Program Director of the Joseph L. Henry Oral Health Fellowship and Minority Health Policy. And we are being joined by Brian Swan, Assistant Professor and former Assistant Dean of Diversity and Inclusion at the Harvard School of Dental Medicine, and Chanel Williams, Dental Officer, Division of Oral Health and Centers for Disease Control and Prevention in Atlanta. Next slide. A little background about the fellowship and the goals. The fellowship is really designed to create leaders, oral health leaders, who have a particular interest in pursuing careers that in health policy, public health practice, and academia. Leaders who will over time increase the capacity of healthcare systems to address the needs of historically marginalized and vulnerable populations. But this program doesn't just end at the end of the fellowship year. It's also about the continued career development and advancement of alumni fellow. And you hear some about that from Brian and Chanel. Next slide. History of the fellowship. It was initiated in 2001 with support from both HRSA, Health Resources and Service Administration of DHHS, and the California Endowment. And it's in 2005 that it was renamed as the Joseph L. Henry Oral Health Fellowship and Minority Health Policy, really with this intent of continuing his legacy of providing resources, support, mentoring for the next generations of leaders in minority health and minority health policy. Next slide. Some of the background. There have been 15 oral health fellows. The majority are in the private sector, but also in academia and in the public sectors. 100% have remained engaged in policy research and service delivery, and they are functioning at both the local and state levels, national levels. A third of them have received honors and awards, and a third have actually published their works. Next slide. Eligibility for this fellowship includes a DDS or a DMD degree and an active dental license, one or more years of experience in dental practice or completion of a residency are preferred. Experience with addressing and improving the health needs of historically marginalized or vulnerable populations, and interest, a genuine and interest in minority health, health policy, and public health. U.S. citizenship or U.S. permanent residency is also required. And part of the benefits from the fellowship include full tuition, health insurance, funds for books, travel for related programs, and financial assistance for a practicum project. But I think the most important benefit of the fellowship is the fellowship of the fellows, and you'll hear more about that next. It includes a degree from either the Harvard Chan School of Public Health or the Harvard Kennedy School of Government. From the Chan, the School of Public Health, the MPH is available, and the MPA is available from the Kennedy School. The MPA is available to individuals who have already earned their MPH before applying for the program. There are 2 fields of study from the School of Public Health. Individuals can choose either health management or health policy. But during the fellowship, there's cross-registration for courses from the Kennedy School, the Business School, the Education School, really across the Harvard community. In the 23-24 year, this program will be in person. There will be some virtual activities, but this is an in-person program. And you see here listed some of the courses that you'd expect to see in an MPH or an MPA program, such as biostatistics, EPI, economics, finance, but also courses around leadership and health policy and understanding health systems, decision analysis, healthcare quality, innovation and entrepreneurship. And in particular, there's a seminar on leadership and minority health policy. Next slide. Activities of the fellowship include building personal narratives, expanding career networks, fostering systems understanding, connecting leadership and policy programs, and strengthening alumni connections, very much about making the kinds of connections that can be used during the fellowship, but also post-fellowship. Next. In terms of the program, the deadline for application is December 1st, 2023 for the Oral Health Fellowship and Minority Health Policy, but a second application is required, either for the Master of Public Health at the School of Public Health or the Master of Public Administration at the Harvard Kennedy School. And so there are 2 applications that would be required. We go to the next slide. Here you see examples of some of the career paths of alums of this program. You see from the public and private sectors, you see individuals who have served as dental directors, consultants with the FDA and in other places from multiple states. You see them from the East Coast to the West Coast, from Massachusetts to New York and Maryland, spreading out to Arizona and other parts of the country. And so it's our hope that you will consider applying. I think it's important for you to now also hear what the experience of our alumni are. And we're going to turn to a video, a very brief video, for you to be able to hear from them themselves about what this fellowship meant to them. And when we return from that, you'll hear from Brian and Chanel. So now a video clip about alumni experience.
Hello, my name is Dr. Brian Swan, and I am a Joseph Henry Fellow. And one of the things that this fellowship at the Harvard School of Public Health, through the Harvard Medical School, and under the mentorship of Dr. Joan Reed, who I'm proud to say is still a mentor of mine. I came into a situation at age 58, so I'm the oldest fellow, to learn about policy and advocacy and research and the significance of it. This is what the School of Public Health at Harvard and the degree of an MPH and being a member of the Reed Scholars in Minority Health Policy. This is what they gave me the tools for, to be able to investigate, to advocate, and to be a part of the team of people who are trying to make a positive difference.
The Joseph Henry Oral Health Fellowship armed me with the confidence and skills that I needed to seek out and pursue opportunities that veered a little off the traditional career path that comes to mind when one thinks about dentistry. My experiences, as well as the exposure that I gained through the fellowship, helped to guide me as I made a pivot away from full-time clinical practice and led me to the role that I have today. We are truly challenged to think about our own biases and what that may look like, not only as a clinician, but also as a public health leader. Ultimately, I think that our fellowship challenges the fundamental way in which we think. It forces us to recognize our limitations within systems that were not designed for us to thrive, and teaches us how to become visible within those systems.
Hi, my name is Dr. Wayne Stevens, and I'm the current Joseph L. Henry Oral Health Fellow. As part of my fellowship, I am studying for an MPH degree in health policy. And this fellowship has been an incredible opportunity for me to learn from very high-level leaders who are crafting everyday health policies that affect us and our patients, and more importantly, our communities. But in addition to being in an MPH program, the fellowship offers a ton of resources and support, and also a connection to a network of other fellows and leaders who are very instrumental in health policy that'll really help you to get further along in your career of being a leader in minority health policy.
This particular program equips you to go into the battlefield, more or less, and make a positive difference with data, with the language that you understand, and the support and the passion that comes from all of us to pay it forward for the people that we need to serve.
So I invite you to consider applying for the Joseph Henry Oral Health Fellowship at Harvard University. We want you. If you're interested in further developing your leadership skills among minority and vulnerable populations, this fellowship is for you. Join us.
Thank you for taking time to watch the video. And now we have this opportunity to hear from two alums of the program. One you actually saw in the video. I introduced Brian Swan to you earlier, talked about him being former assistant dean for diversity and inclusion at Harvard School of Dental Medicine. But he also served as chief of oral health for Cambridge Health Alliance. He's global oral health outreach committee of the National Dental Association, oral health specialist for Job Corps of America, and also a founder of the Wampanoag Native American program here in Massachusetts. And with that, Brian Swan.
Thank you for the introduction, Dr. Reed. And it's a pleasure to be here to address this audience of people who are looking forward to expanding their horizon. My trajectory was practicing prior to coming to this program 4 or 5 years in public sector, but also 25 years in the private sector. And I started attending meetings where they were reviewing grants, and there was a language that I didn't understand that people were talking about. They wanted my clinical expertise, but I also wanted their policy expertise. And this language of public health is a little bit different. And what I saw is that people at the policy table were making policies, plans, setting up programs that were going to affect millions of people at one time. But oral health is often left out. Oral health sometimes is viewed as an outlier. Being able to take clinical experience, combining it with policy and advocacy, puts you in a very unique position, and that's what this fellowship offers. I didn't know that they wanted somebody with at my age, but it was my experience that they were also interested in. I learned how to speak the language of public health. I understand the impact of policy and advocacy. It gave me a whole new set of skills and basically reinvented myself. The only thing that I had that I didn't like is that I didn't do it 15 years earlier. I wish I had known this information going through my entire career, because it just gives you the tools to make a really serious and positive difference. Coming to Harvard is serious business. Harvard's motto, through its level of credibility, is to train leaders. So for those of you interested in getting out of the box, I didn't know I was in a box. Dentistry is a part of the issue in terms of what we do. It's not the whole picture. The bigger picture is oral health. And oral health involves so many different aspects. And it's a great career. But part of the reason it makes it great is that there's so many opportunities that are not being addressed. So if you're a person who's interested in leadership, if you're a person who wants to home in and improve your skills for advocacy, understanding how to collect data to make policy, if you're looking for leadership on a high level, this program would be for you. It changed my life. In my week, I get a chance to be an administrator, a clinician, a researcher, and a policymaker. I create programs on a global scale, which just makes my career so much more colorful. So I think that for those of you who really want a challenge, who want to really take this to the next level, a sophisticated and a high level of making positive change at a time where we really need it, at a time where dentistry is not moving as fast as other healthcare professions to be more inclusive. We are too important not to be inclusive. So I challenge you with those who really want to work hard for a real strong year that's going to change your life for the good to be able to do that. I'd like to introduce the next speaker, Dr. Chanel Williams, who is also a Joe Henry Fellow and colleague. Chanel?
Hello, everyone. Again, I'm Chanel Williams, and I served as the Joseph L. Henry Oral Health Fellow in Minority Health Policy from 2015 to 2016. I'm feeling very thankful for the opportunity to share with others about how impactful that fellowship experience was to the development of my career. With each passing year since I completed the fellowship, I continue to grow more and more appreciative of the training, the network, the mentorship, and all of the resources that were provided to me during that time. I say that not only because I've been able to directly apply what I've learned during the fellowship to the training and career chapters that followed, but to this day, I am still tapping into those resources to continue to grow and learn how to demonstrate my personal leadership skills as I work to support awareness of oral health disparities. The fellowship supported embedding seminars and courses specific to learning about issues in minority health policy, leadership in minority health policy, and policy analysis into my MPH curriculum. And one of the first really eye-opening moments for me during those fellowship supported courses was how expansive the phrase minority health policy is really meant to be. I say that because during those courses, while we did certainly spend time learning about health disparities by race, we also spent much time over the course of that year learning about disparities by so many other modes of comparison beyond race. And we learned not just about preventable differences in health outcomes, but also about issues such as preventable differences in representation within academia and various fields of the healthcare workforce. And it was during those fellowship courses where I started to learn about how to advocate for the inclusion of oral health in those discussions. I also began learning about the different ways in which a person or group may experience barriers to improved health outcomes and what it means to view problem solving from an equity perspective. And that is something that I have been able to directly apply to a number of duties and work positions that followed, such as my time as lead dentist at a nonprofit clinic serving uninsured adults, and my current role that primarily involves oral health related research and providing consultation for different oral health related programs and surveillance efforts at various levels of government. As stated earlier, practicum was a required component of the fellowship, and my practicum involved interning with the Massachusetts Department of Public Health as a member of their implementation team for a 5-year project that had the goal of increasing utilization of dental care services by 10% among pediatric subpopulations living in 2 counties in Massachusetts that were experiencing low access to preventive care resources, high burden of dental disease, and were relatively marginalized. And during that internship, I learned about the value of community engagement from like inception and to completion of an intervention program. I had the opportunity to practice searching and critically reviewing literature, and I contributed to the drafting of oral health disparity profiles for those 2 counties. So to switch gears a bit, that year, many site visits and meetings with leaders in government, healthcare, academia, and then the health insurance sector, just to name a few, were orchestrated and woven into our fellowship schedules. And just as an example of how incredibly extensive Dr. Reed's network is, her office organized personalized site visits for the fellowship cohort to a majority of the agencies within the Department of Health and Human Services. And to further tailor my experience as the Joseph L. Henry Fellow at that time, Dr. Reed periodically held one-on-one and small group mentoring sessions. And during one of those sessions, she asked me to put forth the names of 2 places that I would like to have dental-focused site visits. And once again, because of the large network she has developed over time, she made it happen. In fact, I actually got to have 3 additional site visits. During that year, I had the opportunity to receive mentorship from the executive director at the American Dental Association. I had the opportunity to do a site visit and shadow at DentaQuest, and also shadowed at the Centers for Disease Control and Prevention. And those were such meaningful experiences because not only did I have the opportunity to shadow influential leaders in dentistry and in government, but I left those site visits feeling all the more inspired and encouraged to pursue a dental career outside of the traditional clinical setting. By the time I finished the fellowship, I gained life-changing clarity about where I wanted to take my career. I realized that my professional calling was to become a dental public health specialist. And now, as a board certified dental public health specialist, I'm using every bit of what I learned during the fellowship and every training and career opportunity that followed to now serve the public as a dental officer at the federal government level. I have no doubt that the fellowship experience helped shape the career path that followed for me. And if you look up all of the different fellows that have completed the program, you will see a great deal of diversity among us and our career paths. I thank Dr. Reed and all of the supporters of the fellowship for helping each one of us gain more self-awareness and for equipping us with resources that will guide us throughout our careers, and for encouraging us to embrace our individual strengths and our personal styles of leadership. So thank you for the opportunity to be part of this informational session. Joan, I will turn it back over to you so that we can have some time for questions and answers.
Thank you. Thank you, Brian, and thank you, Chanel. Thank you very much for your comments. Looking at the questions in the Q&A, one of them is about how many fellows are accepted per year. There's 1 Joseph Henry Fellow per year, and it is an in-person program. It was virtual for a short period of time during the pandemic, but has returned to being full in-person, and it's a full-time program. The other question is about working while doing the program. And I'm actually going to turn that over to Brian and Chanel. It's a pretty intense year. Some people are able to do some sort of other work or moonlighting, but for you to give your sense of the workload of the program, but both of you to also speak about the fellowship of the program and the connections you make, please. And both of you are mute. Okay.
Go ahead, Chanel.
Sure. I will say this for the person that asked that question. I remember when I first joined the fellowship, I asked one of the previous fellows, if there's like one piece of advice, what would you give me? And they said, the experience is what you make it. It's up to you to tap into the resources that are made available to you. And I would just encourage that person to think of, you have your whole life after the fellowship to continue doing, building out your career, but there are just so many opportunities in addition to completing the MPH program or whatever degree that you focus on, that for me, I spent that outside time taking advantage of those opportunities to gain mentorship from the expansive network that was part of the fellowship. Dr. Swan, I'll turn it over to you.
Well, thank you. I felt that I came through college and dental school, went to UCSF at a time during the civil rights movement. Those were difficult times because we were integrating schools that had not had students of color before. But when I came many years later to Harvard, the thing that I noticed immediately is that there were people who were there supporting me. I mean, I needed a tutor. My computer skills were null and void. I needed to have a little extra help in biostatistics. And there were people who were also listening to my creative ideas. I'm always been a visionary. So being able to have people who would listen to that and encourage me was completely new to me. And I was turned on by that. The other thing that I really enjoyed about being in the School of Public Health, yes, it's intense. First semester is all the rudiments, you know, economics, biostatistics. I had never taken an econ course before. It really helped shape a perspective of understanding how the world works and why it works the way it does. I had instructors like Jim Kim and Howard Koh. Howard Koh, Assistant Surgeon General. Jim Kim, one of the co-founders of Partners in Health. Paul Farmer, one of the co-founders of Partners in Health. These are people who became president of World Bank. I got a chance to meet with people who were doing all kinds of work. One of my instructors was a person who ran for president of the United States, was an instructor. And we got along. We would talk, real talk. That flavor speaks for itself. It has enabled me to do things that I thought that I could never do. Sometimes we walk around with imposter syndromes, wondering if our ideas really make any sense. You realize that in the School of Public Health, especially in the second semester, where you have problems to solve working together as teams, you realize that being an oral health person, and I call myself an oral physician because it's broader than dentist, uh, that you're working with medical doctors, lawyers, nursing people, all of those people who are coming to work together as a team to solve problems. You realize that your input is as valuable, if not more. And therefore, it is a good feeling to understand and to also understand the concept that working together as teams is how we solve healthcare entities. We cannot solve the world's problems working in a vacuum. It is not just about dentistry, it's the whole picture. Mental and behavior health, inclusion. You know, as we look at our profession, it needs to be more inclusive. It is isolated from the other professions, and it's isolated from millions of people who can't afford what we do. We have to come up with innovative ideas. And going back to being a visionary, there were people there who were encouraging those types of ideas, thinking out of the box. You definitely want to get out of the box and get out there and not be known just about teeth, but being known about a person who specializes in the oral cavity, but who is interested in whole body and holistic health. Thank you.
Thank you to both of you. Um, there is a question here, and I think both of you are wonderful as examples of this. And the question was really about the timing of when to come in. Am I too old to come in? Am I too young to come in? What kind of experience? And you both came in at different points in your career, and maybe you can underscore that. Brian, you've already talked a little bit about it in where you said what you'd done in sort of the public and private sector before you came. Chanel, you haven't really talked about what you did before you came, but that range to me is actually a strength of the program. That everybody's not at the same exact point in their career. Maybe you could speak to that.
Sure, I'd be happy to. I will say that, since high school, frankly, the first time I did a community service project, I think that's when I got bitten by the bug of realizing before I had the language that I wanted to serve the community in some way. And then when I fast forward all the way to dental school, started learning about dental public health. And I couldn't quite wrap my head around what it was, but I understood that it spoke to issues in access to care. And I just remember, growing up, I would see a dental office on every corner where I grew up. And then when I started doing my first shadow experience, I remember the first patient I sat in with as an assistant, they said, I had to drive 4 hours to get here to get some care that I could afford. And that was my light bulb moment of there is a problem that I think I want to be a part of how to help solve. So throughout high school, undergrad, and dental school, I always made time to try to get into community service and dental public health, again, before I really understood that public health was a formal formal career path. And I had done a general practice residency right after dental school. And that's where I actually met Dr. Swan, who is my past residency director. And I was telling him about my passion for increasing oral health literacy and cross-cultural competency and all of these different things that I just felt very passionate about. Like as an HBCU graduate, for example, I was aware that about 4% of the dental workforce is non-Hispanic Black dentists. And he said, you know, you should look into the Joseph Henry Fellowship. And I remember looking and seeing, oh, all these people, they have so much experience. I'm nervous about applying. And, you know, I got accepted and it was a life-changing experience. And I felt like I was able to contribute to the conversations and the diversity within the fellowship. And I learned so much from it. So I say that to say it's not too soon or too late to consider applying to this program.
Thank you
Uh,
both. As we were speaking, because this is another part that's here, the question came in of, is the MPH tuition covered? The full tuition is covered with this fellowship program. So absolutely, yes. Brian, were you going to say something?
Well, I was just saying that, everybody's unique and you all bring in different experiences in the way you were raised, where you were raised. Those experiences are relevant. Don't count anything out. And then, when you start getting the tools to start lining that up and putting that together and understanding how you can affect the communities, your family, the populations that you want to serve. The reason that I came in as an older person and I didn't think that I would get in because of my age was because of my experiences. Harvard Dental School was trying to go global, and I had a lot of global experiences, not only working in the United States, in various communities, Mexican farm workers, East Palo Alto, which you call Little Nairobi, working in those communities, always making my private practice part, 25% of it was always public, going to convalescent homes, working in the schools, doing oral health days, and then bringing that type of information to Harvard. Harvard has always trained medical dental students together in the first year or two, but they were not reciprocating in that training. So what just from those experience introduced to Harvard what we call Oral Health Day, where we train medical students to do an oral exam, to look for things like oral cancer and to not exclude the oral cavity, and also building that into the most popular course in the first year of Harvard Medical Dental School, patient-centered care, where they interview live patients and getting oral health questions into the review of systems. As common sense as that may sound, it wasn't being done. Your experiences are given to you for a reason. You being on this call is for a reason. Dive into that. And as Chanel has pointed out, it's never too late or too early. Get it when you can. When it's offered to you, take it. The tools that you need along the way to be successful, you will find them. And when you find them, open up, take the chance, step out on faith, and give it a shot. This particular fellowship at Harvard trains leaders. If you want to get your foot in the door, a Harvard degree is going to get your foot in the door. What you do once you get inside is up to you, but it will get you in. And that applies globally, all over the world. Many trips I've taken the NDA and ADA to Africa. We put on the first Ethiopian dental meeting, international meeting. We've done all kinds of things like that. But it gets your foot in the door having this degree. So it's a meal ticket. It's something that you can spend wisely. If that is your mission to make a difference in your community, in your family, and in the global community. So it's never too late or too early.
I want to thank both of you. Remarkable. Thank you for your comments and for your insights and sharing your personal stories. As you can see from both Dr. Swan and Dr. Williams, remarkable individuals who truly are making a difference every day in all that they do. So consider applying for the Joseph Henry Fellowship. Again, the deadline is December 1st, and we look forward to hearing from you. Thank you, Dr. Swan. Thank you, Dr. Williams, for joining us for today's program.
And thank you, Joan.